Hi, this is Cathy Lemmon, homeopath and president and founder of Homeoprophylaxis, a worldwide choice for disease prevention. I began this organization in 2015 because of a growing call for a non-toxic option for immunization. And it turns out this non-toxic option is homeopathic, and it's been around and in use for more than 200 years. But I'm here today to talk to you about something you've probably heard of, this coronavirus or this COVID-19. What I want to present to you will be facts, figures, things that I would like to do to give you confidence, to give you assurance with what is available to you for what you are hearing about today. Because homeopathy is a full system of medicine, non-toxic, holistic. It's been in use again for more than 200 years, and it's fought against, it's prevented, it's treated every symptom that's being associated with this current COVID-19. The other part of the story, however, is this idea of fear that's being promulgated everywhere you are turning, everywhere anybody is turning today in relation to this coronavirus disease from 2019. That's where the COVID-19 comes from. The problem with fear is that it tends to lead to susceptibility. When everybody's afraid of something, guess what? This something may very well happen. It may very well feel invited to happen. So what I really want to be doing as a result of this brief conversation I'll be having with you is to help you feel empowered, feel strengthened, because it's not something that's going to end everything. It's something that happens. It's something that happens as a course of things. And I'm sure that you've heard about this as well too. And I just want to assure you through this that you are right. And I want you to give thought to this question here. What will we allow to win? I'll present to you that the answers are really right in homeopathy. So I want to present this to you. All that we are hearing about regarding this coronavirus is fear. Everywhere we turn, everything that we do, turning on our computers, our cell phones, every bit of news that we are hearing about has something to do with yet another bad something associated with this COVID-19. What I'm going to present to you, though, is a way to have strength, a way to look at this in a more realistic and building sense, because unfortunately, fear leads to susceptibility. When everyone's afraid of something, it's almost like an open invitation that something bad is going to happen. Do we want that? I don't think so. I want to empower you. I want you to know that you don't have to be afraid. Look at this. This is a page that I've found. The URL for it is right at the bottom there. This is from the Johns Hopkins Center for Systems Science and Engineering, CSSE. Johns Hopkins University is a very well-known university uh, for medicine. And this is a page you can pull up. They update it several times every day, and I look at this several times every day. This is its most recent one as of the recording of this taken. This is on the 8th of March, 2020 at 1:03:07 p.m. Central U.S. time. And I want you to look at and consider these numbers. Of course, this is just a picture of them all, but I wanted to give you a good idea of what we're looking at. Okay, basically here we're looking at in the U.S. as of this moment in time, 474 cases have been diagnosed. Now, the thing to keep in mind as well too, that the cases, well, we'll get more into what exactly the coronavirus is, because I do want to let me uh, go back on this just a little bit for you, because I want to not only point out there's 474 cases that have been diagnosed here in the United States. As of this uptake, there have been 80,699 cases diagnosed in mainland China. That seems quite a few, but do keep in mind the population of China as well. Okay. In comparison, as of this uptake, there have been 39 cases diagnosed in the nation of India. I want you to consider the numbers here. When I checked uh, website worldometers.info to get the most update, because that seemed a pretty well-resourced website to get the most updated information as far as what the populations of these nations are. The population that it has recorded for China is 1.44 billion as of 2020. That's quite a few people, okay? Whereas neighboring China, about maybe a quarter of its border is kind of on China, in the northwestern part, the northeastern part. But India, according to worldometers.info, has a population of 1.38 billion. Not a whole lot less than 1.44 billion, but it still is a significant number of people. And there have only been 39 cases diagnosed in India. Now, there's obviously many, many reasons leading to this. One of the things I'll present to you to just think about, because it's not scientifically based, and one of the things that I do with my organization, HPWWC, I put together international conferences. The most recent one actually took place in New Delhi, and I was very, very impressed at how strong homeopathy is practiced and utilized in the nation of India. I'm sure that there are many other factors contributing to that, but I would just like to present that just for some thought. Now, as far as the numbers, let's look at them a little bit further too. Right at the top, as of this uptake, 109,571 cases have been confirmed worldwide. Of these cases confirmed, there have been 3,799 deaths. Every death is tragic. Every death is tragic. This, however, puts the overall death rate of right at 3.46%. All things considered, that's not really a very high death rate, especially when you also consider this number here, over here on the left, being an overall recovery rate of about 55%. Now, some numbers that I want you also to keep in mind when we're looking at this too, because fear promulgates fear. But I want some numbers to be understood as we get more into talking about homeopathy with this, okay? The WHO has shared statistically that for this COVID-19, this coronavirus for 2019, 82% of those exposed to it will develop mild symptoms. Okay, it is a very contagious disease. 82% will develop mild symptoms. Of those who developed the mild symptoms, 15, that's a 15% will develop severe symptoms. And of that 15%, 3% will become critically ill. Now, when you're absorbing these numbers, do keep in mind that those who become severely or even critically ill, it all depends on age and health history. There's a lot of contributing factors, but when you look at these numbers and consider them for what they are, I want to present to you that yes, it's good to be aware. It's good to be logical about this. Wash your hands with soap and warm water. Get plenty of vitamin C. If you're not feeling well, stay home. If you've got a sneeze or cough, do it into your elbow or something like that. Be logical, be sensible about it. But please don't allow yourself to panic. Just turn off social media, okay? Delete those emails that bring yet more devastating news about this. Just use logic, use common sense, and consider homeopathy. Homeopathy was founded more than 200 years ago by a German medical doctor by the name of Dr. Samuel Hahnemann. He had profound results as he was studying this, looking at the energetic influence of things, plant, animal, mineral. He studied this his entire life, and he had many, many followers. For a time, homeopathy was the medical care approach of choice in the United States. We had homeopathic universities, homeopathic hospitals, over 1,000 homeopathic pharmacies. Homeopathy is solid, gentle, inherently safe medicine. And on top of that, in reference to what we're talking about right now, it has been effectively and gently preventing and healing diseases and epidemics for more than 200 years. Now, what I'm going to present from here forward, I've taken in part from my consultations with the homeopaths and government officials that I've been able to work, especially most recently in being in India, but right here in the United States as well. And it's just a lot of good, solid information I really want you to absorb for what we have for you for this COVID-19. Here's just a few records to share as far as the effectiveness of homeopathy in regards to several epidemics. Okay, typhus fever from 1813 and a few episodes of the cholera epidemic. And as you can see on these, that's the little tiny blue line that represents the cases of treated homeopathically. And you can see in every case how small those cases are. And it's interesting to note the cholera epidemic of 1854 in London. Those doing conventional medicine tried not to even let the numbers for those treated homeopathically be released. They were basically kind of embarrassed because their method of treatment was not really working that well. But they were required to release them, and you can see in every case homeopathy works remarkably well. Here's a few more to consider as well. Another cholera epidemic, a yellow fever epidemic that happened right here in the United States in Memphis. Diphtheria, the Spanish flu that we hear about again and again from 1918. That one's presented a little bit differently, but you can see at the bottom how these numbers were just astoundingly small. It says there at the bottom from Dayton, Ohio, they reported 24,000 cases of flu treated allopathically, had a mortality rate of 28.2%, while 26,000 cases of flu treated homeopathically had a mortality rate of 1.05%. This is how effective homeopathic medicines are. Overall, every place that with the 1918 flu epidemic, every place that they used homeopathy to treat, the numbers were the same. Now, so you'll understand a little bit more about what the coronavirus is. The coronavirus is really, you know what, it's nothing new. It was first isolated in 1937 from an infectious bronchitis virus in birds. All right, and then it was isolated for a coronavirus that affects humans in about 1960. We've known about it that long. The coronaviruses typically affect the respiratory tract. They are associated with the common cold, pneumonia, and even as we learned about not too long ago through the SARS, the severe acute respiratory syndrome, and even MERS, the Middle East respiratory syndrome. All right, but this is something that I want you to keep in mind. The viruses are responsible for between 15 and 30% of the common cold. What does this mean? What does this mean? This means it does not mean that every cold is going to turn into pneumonia, okay? What it means is that we should take a bit more seriously treating the cold, okay? Because if you have between 15 and 30% of what we know as the common cold, and it happens to be a coronavirus, and it has the potential to go to your lungs. So just take it seriously and treat it. Don't panic about it, just simply treat it. Now, I'm going to present to you the novel coronavirus signs and symptoms, okay, that have been documented time and again. I work with homeopaths and officials in India, many of them, and many of them are working, of course, directly in China and with Chinese homeopaths. And this is being documented that the common symptoms include a fever, a dry cough developing after 2 to 7 days, mild breathing difficulties at the outset, right at the beginning, gastrointestinal issues, diarrhea, general body aches, a high fever. 100.4 is not really a very high fever, but depending on the circumstance, it can be difficult. It can be difficult. So those are some signs and symptoms. And again, here's a few more. This is directly from the WHO and the BBC. These include, again, the headache, the cough, muscle pain, shortness of breath, breathing difficulties, fever. Okay. And let me share with you here something to really hopefully give you courage about what we have for you through homeopathy for this COVID-19. One of the people that I've been able to gain this information from, his name is Robin Murphy. He's a very well-known homeopath. I have several of his big, thick, couple thousand-page books uh, in my homeopathic library. What he has done is he has lined this up. There are several types of pneumonia out there, but he's put together, and he shared this in a slide in these slides. Main symptoms of infectious pneumonia. What do they include? Guess what? Headaches, high fever, cough, with shortness of breath, okay, gastric issues, muscle aches, fatigue. Guess what? Does it sound familiar? Does it sound anything like what we're looking at with the coronavirus, the COVID-19 today? Yes, it does. Homeopathy has had remedies, inherently safe remedies available to prevent, treat, and cure every one of the symptoms being associated with this. And there's a lot of study happening today, right in China, right in Italy, right in Iran, the places where it's hardest hitting. There are homeopaths who are working to get what we call in homeopathy a genus epidemicus. What is a genus epidemicus? The genus epidemicus is something that produces the same symptoms in a certain population, here and here and here. When they've found that, once they find that, and they're getting very, very close, they're able to produce a nosode, a special homeopathic medicine called a nosode for this genus epidemicus. Until then, however, we have remedies that have worked, again, for more than 200 years. Let me share this with you. This is what Robin Murphy has shared as well too. This is just one of 7 pages that he listed in his own PowerPoint of symptoms that he has put together associated with pneumonia. Those are a couple of his books there. The Meta Repertory, the Nature's Materia Medica. They're at least a couple thousand pages long, each of them. They, well, you can look at this, and just on this one page, you can see all the remedies that have been effective against the symptoms that are associated with the pneumonia and therewith associated with this coronavirus. The coronavirus is not the same as the pneumonia, of course, but this is why we have the repertory books that have so many different symptoms in them. There are many options available to you through homeopathy. I'm not going to list them for you here. Rather, what I'll do is I will let you know that homeopathy is available to help with this new coronavirus, the COVID-19, for prevention, for cure. Let me make it clear that again, at this point in time of my recording this message for you, conventional science, conventional medicine does not have a specific treatment for this COVID-19. Neither does homeopathy, not specifically for it. Why? Because I've just explained we do not have the genus epidemicus defined clear enough yet. However, we have all these remedies available for you. And the homeopaths who are on the ground in these areas are defining these clearer. Let me present to you as well to the idea about homeoprophylaxis or homeopathic immunization. This is also available to you. This has also been in use for more than 200 years. It is a good thing for you to be able to pursue. Contact me at the email below or at the website below, or your homeopath or your HP, your homeopath prophylactic supervisor, for more information. I want you to be at peace, not panicking, because I don't want you to be making yourself more susceptible to anything out there. Okay? Above all else, I want you to be at peace, knowing the solid historical effectiveness of the strength and gentleness of the inherently safe medicine of homeopathy. It is there for you. It's been helping for more than 200 years now. Let it help you today. Thank you very much.